Certainly, if you talk to hospital leaders around Nebraska, workforce would be priority one, but the growing financial pressures and then post-acute placement are right up there in terms of the challenges they're facing. I think we hit on the impacts here. Obviously, there's impacts to patient care, both for the individual who can't get transferred to the right level of care. If you're not in the right setting, your recovery isn't going to be as good as it could be if you were in the right setting. That even means moving from an acute care hospital bed to a rehab. You may consider that a lower level of care, but it's the right level of care for you, and you're going to get the right rehabilitation supports there to have the best recovery. Certainly, no one would benefit from unnecessarily being in a hospital bed for 6 months or 300 or 400 days, as we've heard in some situations. So it really, first and foremost, is a patient care issue. These more challenging patients unnecessarily being in the hospital, being in the wrong setting, adds another layer of taxing work to our hospital staffs that are already stretched and stressed. Having a behavioral health patient in a non-inpatient behavioral health bed and just a general acute care bed, it's more work and it's more challenging. We got to get those patients in the right level of care.
When a patient no longer requires care in an acute care facility, there are a variety of options. Each week, the Care Transitions team at Bryan Medical Center meets to discuss patients who have a significant barrier to post-acute care placement. Last week, there were 22 patients on this list. Guardianship is the key barrier for 6 of those patients. 3 of those patients who are waiting to have a guardian assigned to them from the Office of Public Guardianship now have hospital lengths of stay of 350, 142, and 113 days. The average length of stay for a patient at Bryan Medical Center is approximately 5 days. If each of those patients had been appropriately discharged to a post-acute setting, 118 additional patients who did require acute care could have been cared for in those 3 beds alone. Stated another way, we have had an average of 389 avoidable patient days each month this year.